Thanks for tuning in and welcome to part 2 of Dental Talk 360, our episode on clear aligner therapy. In today's episode, we have Dr. Sofia Arauz from 3D Predict, a clear aligner therapy company. And I'm Dr. Melanie Silvestrini.
I'm Dr. Oscar Sanchez.
I'm Dr. Barton Santos.
I'm Dr. Alfredo Arauz.
In summary of our previous episode, we spoke a little bit about clear aligners, orthodontic therapy, and the benefits of having a proper diagnostic exam with your dental provider prior to considering orthodontic therapy. And there are so many benefits to considering that because your gum and bone health is very important before considering getting orthodontic therapy. Dr. Sofia, would you mind elaborating a little bit about the importance between having a 3D bone analysis or an AI company such as 3D Predict for patients to have better understanding of their treatment and their health concerns prior to beginning?
Absolutely. So until now, orthodontics has been done based on 2D X-rays. But patients are 3D. We all are 3D. And we need 3D X-rays to be able to treatment plan your cases properly. When you have a 2D, you're only seeing what's happening on the side, you know what's happening front to back, and there could be any issue with your bone, different root morphologies and anatomy that we're not accounting for when moving those teeth. Remember, we're moving your teeth inside of the bone. So 3D Predict, that's where the name 3D comes from, takes into account CBCT. What's different about 3D Predict is that we have been doing this, taking into account CBCT cases for 7 years. So we have thousands and thousands of CBCT cases that we have treated. And even if your doctor doesn't submit a CBCT, we have developed AI protocols based on the average coming from those CBCTs. So for the average of the cortical plate, which is the bone, the average of the root morphology and anatomy for each tooth in your mouth. So let's say your doctor doesn't have access to a CBCT. Your doctor doesn't want to take a CBCT. You don't want to take a CBCT. Your treatment is still going to be more predictable and a little more conservative because we have those AI protocols in place. So when your doctor submits your dental scan or your PDS impression, submits your pictures and submits a CBCT, we give them a full 3D rendering of your bone, your roots, and the crown of your teeth. And he or she can see, or they can see, how those teeth are moving in the bone step by step until the end of the treatment. No other company does that. So if there's any problems with your bone at any stage of the treatment, any issues with your roots collapsing with each other, because teeth are very close to each other, so it can't happen that your roots are touching each other, and we don't want that to happen. Your doctor is going to be able to see that on the treating plan and correct it before it even happens. So it is definitely a game changer in the industry, and that's why I work for this company, because I do think it's the future.
I think that it's very important for patients, whenever they get any treatment with aligner companies, it's just to be able to ask for the correct records. So like you were saying, it's the tooth is in a socket, so it's sitting inside bone. And when you do 2D imaging, you only see what's on the side, you don't see the bone in the front or the back. Now, aligners, most companies, what they do is they put the teeth straight. So you can have straight teeth, but if I have to move your tooth forward in order to put them in line with the rest of the teeth, but you don't have any bone on the front, in 5 or 7 years, you're going to start having a recession on that tooth. You're going to start seeing your root of the tooth. And that's what patients don't understand. They want to have this straight teeth, but sometimes you're not able to make some movement. So it's good to have this initial record so that you can see exactly where you want to move the tooth and if anatomy allows you.
And it allows you to avoid complications.
Exactly. So it allows you to avoid complications because a lot of patients and a lot of that had this treatment, they show up to me, and then their main concern is that they're having recessions in all the teeth and they're asking me why. And a lot of the times I ask them if they did any orthodontic treatment in the past, and they did. And it's usually something that shows up 7-8 years down the line. So you're not going to notice it. You're going to be happy that you have all these straight teeth, but then in 7-10 years, because the whole purpose of our job is doing something long term. It's not about that immediate gratification. It's about doing a work that's going to last you 10, 20, 30 years down the line. And then once we get there, to have a backup plan to move forward, because we want you to keep your teeth the rest of your life like they should. So
yeah, exactly. And much more than that, there's also, because people don't know, right, that when you have ortho treatment, when you have braces, when you have aligners, not all companies are made the same. Not all appliances are made the same. So when you have to make a certain movement and it's very complex, you are gonna need additional appliances. And what that means is you're gonna need rubber bands that you're gonna have to change, 3 times per day, sometimes more. You're gonna have to have mini screws inserted in your bone to be able to hold that movement in place. You're gonna need like extra metal appliances to do that job. With 3D printing, because we know the anatomy of your tooth, the full anatomy, including the root, and the bone around it, because teeth move within a bone, they don't move in space, right? They are free objects, that we are able to do movements much predictable, but also more range of movement without using all these additional appliances. So it's easier for the doctor and it's easier for the patient too. And it's also faster because with ortho, and I think all patients know this, all patients that have gone through ortho, they know your doctor may say, oh, this treatment is going to take a year, and then it's 2 years after, and you're still on braces, and you're like, am I going to be able to get married this summer? Like, and take these pictures, right? How am I going to look with all this metal in my mouth? With 3D printing, it's different because, once again, if you know the full ortho anatomy of your patient, you can predict. It's not a guesstimation anymore. You know where to apply the pressure, the force, to move that to predictable. So in reality, 3D printing is usually 30% faster than other orthodontic treatments. Not because we're moving teeth faster, because you don't have that extra conversation with your doctor of, well, this is not tracking. What am I gonna do now? Like, oh, this tooth is not moving. What am I like? Are we gonna have to do 6 more months, right? Yeah, adjust this here, adjust this there, make more aligners. You don't have that conversations. It happens very rarely unless your case is very complex, because we know all the diagnostic records from the beginning, so we can make that prediction.
Also, the beauty is, I graduated in 2012, and I stay current with all my education, as all of us here. When you don't, that's when you fall victim.
Yes.
I mean, we saw an IG Live with Dr.
Yes.
Miguel Ortiz and some clowns. And
Yes.
what happens is, if you're not aware of the technology that's out there, you
fall behind.
Yeah.
Mm-hmm.
I was introduced to 3D Predict about 3 to 4 years by a friend, and I was very interested in technology because the fact that it incorporated, it was mandatory that you submitted the CBCT, and for me, it was interesting because the reduction in revisions and the fact that you can move the teeth and you knew where the foundation and housing was, it was interesting to me. And then furthermore, I found that I think Google is an investor in 3D Predict.
So we're working with Google right now.
Yeah, and for
So
me, that's like
And
amazing.
we have access to early AI tools that
Yeah.
nobody has
That's
access to.
And that's what's awesome,
Yeah.
because a few years ago they needed that CBCT, but now with AI protocols, it's obviously
Yeah.
it's more beneficial to have that CBCT. But if a patient decides they don't want to have one for radiation purposes or what have you, it allows them now the AI to benefit without that too, which is awesome. Again,
Yeah.
going back, technology, dental education, and making sure that in your practice you're moving forward is what's the key. Or if not, you become archaic.
Yeah.
And that's not a way to practice.
And Fede, can you talk a little bit more, because I know you know the data on the radiation comparable to normal things, so that because a lot of patients are
Yeah.
scared of radiation, scared of these machines, but with technology that has advanced so much, the amount of radiation that you actually get from doing this is
So a funny thing that I tell my patients is, have you ever gone on a plane? And they'll normally answer yes. And I go, have you ever had a banana on a plane? And if they say yes, I'll say, well, you had more radiation having your banana on the plane than you did in the CBCT. It actually is less radiation to have a CT scan of your head and neck than it is in a dental practice setting. Obviously, there's medical practice settings that are different, but in a dental practice setting, the CBCT imaging that's done, or the 3D imaging, has less radiation than literally eating one banana in a flight. So that is something to consider whenever someone's worried about having that exposure. 10, 20, 30 years ago, big difference now. Now it's a completely different ballgame. we've been able to hone in on those images without causing detriment to our patients, which is awesome, right?
So if I don't eat the banana, I get less radiation.
That's
No bananas.
yeah, unless you have a potassium deficiency.
Dentistry is such an evolving and dynamic profession where we will be continuing to use advanced technologies such as artificial intelligence, and it's really exciting to know that we can be super accurate when diagnosing and treating a patient, especially for orthodontics. So those diagnostic records are really, really important to consider as a patient before you go to your dentist so that you're more aware of what is necessary to move your teeth safely. Now, moving your teeth with orthodontics is commonly known as closing spaces, making your teeth straight, but orthodontics can actually be used in other ways to make space or maintain space. Dr. Sophia, would you mind elaborating on how 3D Predict has a lot of cases with maintaining space for specific restorative procedures such as implants or build-ups in the future, composites?
Sure thing. And I think it's important for patients to understand that until now, ortho wasn't really an option for dentists because of all the additional appliances that I mentioned before. For example, pushing your teeth back into the bone, which is called intrusion, once a teeth has basically super erupted, it's very difficult movement. You need to know the anatomy of the tooth to be able to place that force where you need it specifically. So because of that, it was a guesstimation of, okay, let's put this mini screw over here, let's put this rubber band over here. And that got very complex for dentists to do, right? And even then, when you go to an orthodontist, sometimes that treatment doesn't really track that well, and there has to be revisions. So based on that, with 3D Predict, because you know exactly the anatomy of the tooth, the morphology of the bone, the anatomy of the bone, you know where to apply that force. You don't need those extra appliances. And that makes it accessible to dentists to be able to do it now for you. So when you go to your dental provider and they say, you need a crown, you need an implant, we don't have a space, we need to open the space because other teeth have basically invaded that space. Now you can upright those teeth and push them back into the bone in a more conservative manner without having all this extra stuff that you need just with our aligners because of the artificial intelligence, because we have complete diagnostic records.
Exactly. So now with the aligners nowadays, we're mainly cosmetic dentists, so we do a lot of full mouth rehabilitation and things like that, and we can attest that we've all used aligner companies to get the teeth into a better position. We're talking about the live, how I'm not going to mention names, but this dentist is just pretty much taking teeth out or grinding teeth down to be able to put the crowns in the with the whole purpose of giving aesthetics to something instead of doing it the correct way, which is putting the teeth in a better position so that you can now be more conservative with the treatment. Because once again, it's not about the immediate gratification of having that before and after. It's about having longevity. It's about thinking about
long-term, thinking in the future.
Yeah, exactly.
Right.
I think at the end of the day, everyone needs to know nothing lasts forever. I mean, in dentistry, there will be revisions. So you spend X amount on dentistry, doesn't mean you're one and done.
Yep.
So us as young, educated dentists, we want the best for our patients. And I always tell my patients, I know it's going to be 8 months, 10 months, 12 months for this orthodontic treatment, but it's a short time of pain for a lifetime of gain.
Exactly.
I agree. And then when they want instant satisfaction by doing restorations and being more invasive by cutting natural tooth structure, with 3D Predict, you can move those teeth in a shorter amount of time and then still get a better result, right? So you're not taking a year and a half to move those teeth and then doing the veneers. You got 3, 4, 5 months, 6 months max if you need to do something, or depending on your case, and then you're able to restore that very, very well. And now you have a lifetime, without compromising the health of your mouth. It's at the end, all of us here as dentists, that's what we made an oath to, right? Do no harm and keep your oral health at its optimum. So that's what's amazing about it.
Yeah, and there's a huge issue with direct-to-consumer DIY clear aligner companies, and It has to do a lot about the diagnostic records, as we spoke about, and what needs to be considered prior to starting ortho treatment. Have you had any experience with those DIY companies? And your experience, why would you not recommend a patient to go that route?
If you're gonna take anything from the podcast, please don't do direct to consumer. Please, no. I know, the pricing is very enticing. Right? I understand that, but there's a different price to pay when you do direct to consumer, and that's your health. It really is. It's just a Google search away for patients to look into this. So I invite you to look into it yourself. But in reality, when you don't have somebody, a trained doctor, look in your mouth before deciding your treatment, it's a red flag for me.
Yeah.
It's not only about aligning teeth, it's not sending this to an orthodontist remotely or a dentist remotely and them saying, oh yes, there's crowding or there's a overbite. We can definitely fix this. It's what else is happening with that dentition. Is there cavities? Is there bone loss? Is there gum issues? If nobody is doing that thorough exam on you, they can't really know. X-rays are not going to tell them. Pictures are not going to tell them. And definitely scans are not going to tell them. So you need a dental professional to look at you live. I mean, we have gone very far with technology nowadays, but not to the point that you can replace a dentist in real life, looking at your mouth, making those clinical decisions. So if
Very
there's
good
nobody doing that, don't do it. Because at the end of the day, what happens in those cases is that a lot of times your teeth can be moved to places that are not healthy. They can be taken outside of the bone because the bone has limits, okay? So they can be outside of the bone, and then you can have gum recession, bone recession down the line, and you may even end up losing your teeth.
Or they
10
might,
years
or
down the line.
their dentition might be outside of the bone already.
Exactly.
Or
If
partially
they have
outside of the
relapse,
bone.
like
Right.
we
And
discussed.
now they run into a predicament where their teeth were moved because most patients think, just what they see on the surface, not what's underneath. But if there's nothing anchoring what's holding your tooth down or partially there, and now you swing it because it's all a hinge, now you have nothing holding it. And those teeth become hypermobile, and you end up losing those teeth. And then that leads to worse off than what you came in with.
Right.
So at the end of the day, I feel like patients should do their due diligence, do their research prior to doing anything. Obviously, it's their prerogative to do whatever. But my job as a dentist that takes pride in what he does is educating my patients and letting them know, here's your consequences of going these routes, and you do what you think is best for your own health.
But let's be honest,
Right.
the reason why the traditional consumer goes the DIY route, it's because of money.
Yeah, of
Right.
course.
And-
Of course.
and-
It has nothing to do
But
with
the thing is, for me, and I always tell my patients that two things you can't put a price on: point of contact and peace of mind.
100%.
When you have a dentist that is monitoring the movements of the teeth, doc, this tooth isn't moving.
Mhm.
Come in, I'll take a look.
Right.
When you do this DIY stuff, I mean, taking an impression on yourself. I don't know if you've ever done it before.
There's no reason why
Yeah.
people
It's-
take their own
Dude,
impression.
that's tough.
That was a whole course in dental school. How to make sure it looks right.
Yeah. And then, I mean, you get these trays and you don't know what's going on. You're
Yeah.
doing it blindly.
Yeah.
So for me, I know we're in a society where everything's on YouTube.
Mhm.
You feel, I guess, uplifted. You're like, I can do this myself. I did this myself. But moving teeth in dentistry is not one of those things. You want a professional point of contact, have peace of
100%.
mind to monitor that movement. And then, down the line, that.
But then it gets more costly because now these patients,
Yeah.
let's say they had a bad experience and their teeth were hypermobile. Now they're
Yeah.
coming in for implants or they're coming in for dentures, and that's a detriment long term.
They have
Now
to-
that's something that's irreversibly damaging.
Yeah.
Right.
Yeah.
Yeah, but also patients need to understand that once you're doing any sort of ortho treatment, you are changing your bite, you're changing your
Yeah.
occlusion.
Everything.
So once you get to the end of the treatment, whether it's aligners or whatever you use, once you finish a treatment, you have to check and make sure that your new bite now fits in correctly. So that's something that without a dentist, there's no way you're going to do it.
Yeah.
Because, you know, sometimes you finish a treatment and then when you close, you only hit on one tooth. What's going to happen over time? The tooth is going to crack. You're going to break it because you're putting all your force on one tooth. So it's very
Exactly.
important once you finish with the treatment to have that follow up with your dentist to make sure that your bite is perfect, that everything is in harmony once
Yeah.
once
We
again
spoke
goes-
about relapse, and then retention is a huge part of it all as well. You want to keep your teeth as straight as you want after the duration of your orthodontic treatment. The only way to really do that is with different retention methods. So there's different methods such as fixed or clear retainers. What are the benefits of using either, and in which instances would you recommend a clear?
For me personally, I prefer my patients to have clear, removable retainers.
Yeah.
Reason being is one, it keeps your gums and your gingiva healthy. It lessens the amount of plaque, the amount of calculus that gets, because sometimes that wire or the bar or whatever they use to fix your teeth, that attracts plaque, bacteria, and what have you. Those patients tend to have a lot of inflammation, which can lead to bone loss in those areas.
Yeah.
Secondarily, traditionally, those wires are only housed from canine to canine, so only fixed on the front 6 teeth. The back teeth relapse also. So then you end up what's called the keyhole arch form, which it literally looks like a keyhole, and you end up with your back teeth pushed inward. Now your smile gets collapsed in the back, and then you start putting forces on areas that you shouldn't have. For me personally, that's why I like retainers that are removable, because it covers the full arch, upper and lower. And if you went through clear aligner therapy, you are already used to this,
Exactly.
right?
And you
It's
have to wear
not
it at
something new.
nighttime.
Yeah, you're
Right.
wearing 22 hours a day. You're wearing these retainers,
And-
and now you're gonna wear it just at night. So
And it's something that you could remake and do. I have a lot of patients that come in with fixed retainers that they didn't even realize that the wire broke a long time ago.
Mhm.
And now one of their front teeth shifts forward,
And then you have to go
or
through it all
everything
over
moves,
again.
and you gotta go all over again. So that's why having the benefit of something that's removable, that's predictable, that you could scan over and over again and get it remade. Let's say the dog ate it, if it happens, you know. Now you could wear that every night to go to bed, and there's protocols for that we discuss with our patients to how to make it more predictable for them. What about you, Dr. Arauz?
Yeah, thank you. Thank you, Dr. Arauz. So I think the main thing with retention is definitely you have options, like you said, and I think every dental professional has a preference to. The AAO, the American Association of Orthodontists, says follow your doctor's advice. But my take on that is the more complex your case is, the longer you're gonna have to wear your retention. Sometimes you're gonna have to wear your retention forever, right? But if you move those teeth within anatomical boundaries, like you do with 3D Predict, it's less likely that those teeth are gonna want to rebound, right?
Mhm.
When you put those teeth in an unhealthy position, those teeth are gonna wanna go back to where they were before, even though they may be crowded in the bone and with their anatomical structure, they're healthier. So in that way, I think you have that extra layer, right, of safety with us.
Excellent.
Excellent. Thank you so much. I hope this was an informative episode for you all. If you have any questions, feel free to reach out. Again, I'm Dr. Melanie Silvestrini.
I am Dr. Oscar Sanchez.
I'm Dr. Barton Santos.
I'm Dr. Alfredo Arauz, and I'd just like to thank Dr. Sofia Arauz for coming today.
Thank you so
This
much.
is very informative. We appreciate you.
Thank you.
And the company is doing
3D Predict.
amazing work. 3D Predict. It's amazing.
Thank you very
Thank you.
much.
All right, right on.
Good job.
Great.
2 minutes. That was good.
All right.